You live in Spain. You pay taxes here. But if you walk into a hospital without the right card, you could get a bill for thousands. Let's fix that. Spain's healthcare system is genuinely good. The WHO consistently ranks it in the top 10 globally. Hospitals are well equipped, emergency care is serious, prescription costs are subsidized. But access runs through Spanish bureaucracy, Spanish language interfaces, and appointment bottlenecks that feel designed to test your patience. On the Costa del Sol, you can buy your way into a smoother English language experience through private insurance. But private does not automatically mean better. It means more control over timing and communication. For serious care, surgery, oncology, cardiology, the public system is where Spain's real strength sits. So how do you actually get into the system? That's where it gets complicated. Spain's public healthcare is delivered through regional services. In Andalusia, that's the SAS, the Servicio Andaluz de Salud. You access it through your local Centro de Salud, your assigned primary care centre, determined by your registered address on the padrón. To get in, you need a SIP card. That's the Tarjeta Sanitaria Individual. Getting one requires registration with Social Security, either as an employee paying into the system, a self-employed autónomo, or through something called the Convenio Especial. The Convenio Especial is the route most early-stage expats miss, and it's the one that matters most. If you're not working in Spain, but you want public healthcare, you can buy into the system for about €60 per month, about €157 if you're over 65, but it's not automatic. You need to have been registered on the padrón for at least 1 year, and you can't have access to healthcare through any other route. That 1 year waiting period is what catches people. You arrive in Spain, you register your NIE, you sign a rental contract, you get your padrón, but for the first 12 months, you don't qualify for the Convenio Especial and you're not employed here. So what covers you during that gap year? 3 options. First, your S1 form if you're from the UK and receive a state pension. The S1 gives you access to Spanish public healthcare as if you were a Spanish citizen. Second, private health insurance. This is what most non-EU visa applicants need anyway, since it's a visa requirement. Third, the ECHIC or its UK equivalent, the GHIC. But this only covers temporary stays and emergencies. It's not a long-term solution. Here's where the money question comes in. Private insurance costs between €80 and €200 per month, depending on your age and coverage level. The main providers on the Costa del Sol are Sanitas, Adeslas, CASA, and CASA. Sanitas and Adeslas have the widest hospital networks. ASA is popular with expats because of English language support. CASA offers competitive rates for younger applicants. The key thing to understand, private insurance buys you speed and convenience, faster specialist access, more control over scheduling, higher odds of an English-speaking doctor. It does not buy you better emergency care. For trauma, cardiac events, and serious emergencies, the public hospitals are where you want to be. We break down every insurance option at WaypointSur.com. Costs, coverage gaps, and which providers work best for expats on the Costa del Sol. Most long-term expat residents on the Costa del Sol end up using both systems. Public for serious care, prescriptions and hospitalizations. Private for routine appointments, speed, and when they need an English-speaking doctor quickly. This is the most practical setup once you're established. A few things about using public healthcare day to day that nobody explains up front. Your GP is your gatekeeper. You cannot go directly to a specialist. You book through your Centro de Salud, see your Médico de Cabecera, and they refer you if needed. Non-urgent specialist waits can be weeks or months. Urgent and emergency care is fast. Emergency rooms will treat you regardless of your insurance status. You will not be turned away, but if you're not in the system, you may receive a bill afterward. For EU citizens with an EHIC, emergency care is covered. For everyone else, get insured before you need it. One more thing, prescriptions in the public system are heavily subsidized. If you're working and paying into Social Security, you pay 40% of the medication cost, up to a monthly cap. Pensioners pay 10%. On private insurance, you pay full pharmacy prices unless your policy includes a prescription benefit. Most basic policies don't. Get your SIP card as soon as you qualify. Use private insurance to bridge the gap year. And don't assume that because you're paying for private, you don't need the public system. When something serious happens, you'll want access to both. Subscribe at WaypointSur.com for daily updates on healthcare changes, coverage gaps, and what actually works here. Next up, the Cita Previa system and the 3 mistakes that get you turned away.